Hello everyone, welcome back to my channel. How are you guys all doing today? My name is Joy Oga and I'm a Nigerian YouTuber based in Lagos State. So today we are basically going to be talking about ovarian cancer awareness, and we have a guest that is going to be taking us on that. We are going to be talking about causes, types, treatment, symptoms, and lots more. And so just sit back and relax, grab your note and your pens and watch till the end. You are going to learn a whole lot. Before then, do not forget to give this video a big thumbs up, comment down below anything you know about ovarian cancer and anything else that you may want to share about it. Yes, and do not forget to, of course, share this video with your friends. A lot of people need to know about ovarian cancer and to be aware about it so that they can be informed. Remember that knowledge is power, so do not forget to share this video with your friends, and of course, do not forget to click on that special subscribe button down below and click on the notification bell beside it so that you can be the first person to know when I post my next video. So just keep watching till the end. You are going to learn a lot.
Hey there guys, and welcome. My name is Just Ene, and in today's video I'll be talking about ovarian cancer. Firstly, I would like to appreciate Joy, who is also known as Roses of Life, for this opportunity she has given to me to talk about this. So you guys, ovarian cancer is like a very important topic. Yeah, cancer as a whole is like important topic to talk about. So firstly, before we go right into ovarian cancer and all that, first of all, we'd like to know what cancer is, right? We've been hearing cancer. I feel like some people out there don't even know what cancer is. Yeah, but then I'd like to say, please, a disclaimer, you guys, I'm not yet a medical doctor, all right? I'm still a medical student. And what is cancer? Cancer is simply when the cells in the human body begins to grow out of control and then tend to spread throughout other parts of the body. Now, what is even cells to begin with? So cells are like the basic structures of every living organism, and according to Google, cells are the smallest common denominator of life. So now that we know what a cancer is and what cells also are, we'll go straight to knowing what ovarian cancer is before we can even begin. So now we know that cells and cancer is when cells grow out of control, right, in the human body. So now we're talking about ovarian cancer. The word ovarian came from ovaries, and we know that every human, like every woman out there, has 2 ovaries, or every normal woman out there has or is supposed to have 2 ovaries, which are located on each side of the uterus. Very good. So now, ovarian cancer is simply just a type of cancer that begins in the ovaries. Do you understand? When somebody say ovarian cancer, that simply means when the cells, okay, in the ovaries start to grow out of control and then tend to spread throughout the entire body. That is ovarian. So with that being said, like, we know what cancer is, we know what cells are, we know what ovarian cancer, at least like we know what ovarian cancer is, the basic foundation of it. Yeah, so now we'll be going straight to how do one get ovarian cancer. Now, one can get ovarian cancer through gene mutations which the person inherits from the parents, okay, and this gene mutation that increase the risk of ovarian cancer is called, or are called, the breast cancer gene 1 and breast cancer gene 2. Now, to break this down, this simply means that women who have like mothers or sisters or aunts or grandmother with the history of breast cancer or ovarian cancer has higher risk of getting this disease. But then also, this is not me saying, or this doesn't mean that they automatically get the disease. It simply means they are more prone to getting this disease. They are more prone to developing ovarian cancer easily than just a normal person without a family history or a genetic history at all. So with that being said, we'll go straight into talking about the symptoms and the signs of ovarian cancer. Now, the symptoms of ovarian cancer are not so specific, and because of that, they tend to be misplaced, or they tend to like be mistaken for some common benign conditions. Benign conditions simply means like for some common conditions, like because the symptoms are so not specific, when they start happening, maybe like for us Africans, every little thing is either typhoid, is either fever, is either malaria. So like these symptoms are not specific, and because of that, people tend to mistake them for some other common diseases. But then I'll be going straight into the signs now. Now for the signs, we have like abdominal swelling or abdominal bloating, and this can actually be very persistent. We have weight loss, which is something that happens with like almost every condition. You get, like it happens with like almost every disease. Then we also have nausea, like when you start feeling nauseous, either maybe you ate something that you're allergic to, like that's what comes to our mind. So like you can see that all these symptoms and signs, they seem so like common, yeah, like if I'm allowed to use that word, they seem so common, and then people tend to mistake them. So we have the abdominal swelling, which can be persistent. We have nausea, we have weight loss, we have the urge to urinate frequently, we have bowel movements, like changes in the bowel movements, such as constipation. Constipation is a sign of ovarian cancer. Personally, when I have constipation, I feel like it's because I ate something that is really my tummy, and I have to take something to release it. Like, do you understand? So yeah, those are like the symptoms, or some of the symptoms of ovarian.
So the color of ovarian cancer awareness is teal. I'm going to put a description somewhere here so you can see what I'm talking about. It is teal. So if you want to do an awareness on ovarian cancer, that's the color of item or items you're going to use to do the awareness.
Moving forward, we'll be going into the types of ovarian cancer. So I will not be going so in depth into this just because I have a specific time for this video. So I'm just going to be telling you guys the types of ovarian cancer that we have. Now the thing is that cancer is caused when a cell grows out of control and then produce a lump that we call tumor, right? That is when like a cell has outgrown itself and then it becomes a lump, which we call that lump tumor. Yeah, so we have the epithelial tumor, which begins in the thin layer of tissue that covers the outside of the ovaries. Yeah, the second one is the stroma tumor, and this begins in the ovarian tissue, right, that contains the hormone producing cells. Yeah, then the third type is the germ cell tumor, which begins in the egg producing cell, and this one occurs more in young women. So now, having talked about what cancer is, what cells is, what ovarian cancer is, the symptoms and all that, now we'll be going to the risk factors. So like these are the factors that increase the risk of ovarian cancer, right? So there are lots of factors that can lead to any type of disease, but I'm just going to list some that I can remember right now. Number one is older age, or you can say increasing age. Now ovarian cancer can occur at any age, but then it tends to occur more, or it happens more after menopause. That is to say, from like it happens more in women from the age of 50 and above. But then I'm not trying to say it does not occur in younger women, but then it happens more in the older women. Number two is the family history, or the gene mutation, or genetics, whatever you want to call it. But then that was the part where I explained earlier, talking about when one inherits a faulty gene mutation from the family. That is simply to say that a woman who has like a family history of ovarian cancer or breast cancer is prone to having the disease compared to someone who does not have like the history. The third risk factor I have is the HRT, which is the estrogen hormone replacement therapy. Yeah, and then the fourth one is endometriosis. You guys, I'm not going to have time to explain all these things right now. Yeah, so and then we also have like other factors like smoking, exposure to asbestos, which is like material used for building in the past. Then we also have being overweight or obese. These are all like factors that can contribute to developing ovarian cancer. So now I've talked about cancer, talked about cells, I've talked about ovarian cancer, I've talked about the symptoms and all that, the risk factors. Now we're going to go into prevention. Yeah, so now I'm not going to say that like there's a way, or I won't say there's a way to prevent ovarian cancer, but then I would say that there are things to do to reduce. Okay, there's a way to reduce the risk factor of ovarian cancer, and number one thing that can help in reducing the risk factor of ovarian cancer is taking birth control pills. Yeah, you guys, like, I know it sounds so crazy because birth control pills, which are like oral contraceptives, have like lots of side effects, and then now they are telling us that you can use it to reduce the risk of ovarian cancer. That's medicine for you. So taking birth control pills also help in reducing ovarian cancer. So but then you also have to ask your doctor first, because like I said earlier, taking birth control has like different side effects, like has lots of side effects for different body, different people. Yeah, so you have to like ask your doctor if you are fit to take birth control pills before even consider taking it. But then it is recorded that women who take birth control pills have lower chance of developing ovarian cancer. And then number 2 way of reducing the risk of ovarian cancer is to be open and discuss your risk factors with your doctors. Like, what I mean by this is that you have to be open and tell your doctor if you have like family history of ovarian cancer in the past. That enables the doctor to know how to handle your case, or that enables the doctor to know how to relate with you and how to treat you, or how to take when you have like stuff seriously. All right, so yeah guys, that brings us to the end of this video. I really hope I was able to make sense. Like I said earlier, I'm not yet a medical doctor, I'm still a student, so yeah, I just had to do my best for this, and I really hope I was able to educate one person out there about ovarian cancer. It was really nice doing this, and I really hope you guys enjoyed watching. Please, also before I forget, I also have a YouTube channel which is Just Ene. Yeah, just type Just Ene on YouTube and you'll find me, and I'll really appreciate if you can check out my channel. Thank you so much, Roses of Life, for this opportunity, and yeah, until next time guys, I'll see you all. Bye.
If you have any of these symptoms that were mentioned, please do not forget to get yourself checked by your doctor, just to be sure that you are fine. Yes, and by God's grace, you're going to be fine. Amen. Just do not forget to check with your doctor to be sure that you're fine. Remember that prevention is better than cure. Yes, it is always better and less expensive, way more affordable than the cure. Yes, that's just it. Thank you for joining us today, and I really appreciate your presence in today's video. Yes, please everyone, do not forget to subscribe to Ene's channel. Ene's channel is Just Ene. I will leave it on the screen. Yes, and I'll put a link in the description. Subscribe to her channel. She has a lot of fun content going on there. She's a medical student. She has a lot of fun content going on there. Please subscribe to her channel. And to the person that did our womb cancer awareness as well, Caphi Binna, I'll put his name on the screen and his link in the description as well. Go and subscribe to both channels, and they have really educative and fun content there that can be of help to you and that you will really enjoy. I thank everyone who has been part of the cancer awareness campaigns that I've done this year. Yes, you're the real MVPs. And for those of you that watch my videos, yo, my subscribers, yo, I love you guys so much. Thank you so much for supporting me so far. Yes, and we have reached 700 subscribers. We are heading to 1,000. Oh yes, share the link to this channel with your friends so they can subscribe. We are heading to 1,000 subscribers. Oh yes. Yeah, so that's basically it. Thank you all for joining me on this journey, cancer awareness journey, until January again, because that's the next time I'm doing cancer awareness, which will be cervical cancer awareness. Yes, and for those that don't know, I'm a cancer awareness advocate, so you're going to be seeing me doing this once in a while. Yeah. Thank you so much for joining me on this journey. We have done ovarian, womb, and breast cancer awareness now, and it's been a lovely ride. Thank you to everyone who joined me on this, to everyone who participated on the channel and my videos, and for Project Hope, my Project Hope sisters, and to everyone who has supported me on this YouTube journey. Thank you so much. I love you all. So keep being the best version of yourself, and I shall definitely see you in my next video. Do not forget to subscribe to my channel as well, and to Ene and Caphi's channel. Feel free to watch other videos too. I hope you like my news.